has a little bit of discoloration, and she's light skinned as you can see. But we're going to be doing this procedure on her. So we're using her own blood. She already drew her blood. We're going to put it in a very special centrifuge and spin it down. And what this does is it kind of separates the blood cells. It separates the platelets and the red blood cells, giving us a rich plasma, rich in growth factor. And what does this do? This actually tells our skin to start rejuvenating, start building collagen, start becoming brighter, glow more. So that's what we're going to do. And we're going to pair it up with what is called microneedling. And microneedling is a special pen that has little needles. What it does is it kind of does a controlled injury to the skin. And then we'll kind of put the PRP, have platelets, have blood, and actually do the microneedling with it. So Christina, can we? We're going to perform this live. So everybody, if you have any questions, feel free to call. Area code 478-333-2595, and follow us on our Facebook. Ageless Beauty has arrived. On our website, Twitter, and Instagram. And feel free to DM us. I think we have a question out there. And feel free to DM us, ask any questions while we're doing this. Okay. So, what are the things that microneedling vampire facial does? Number one, it helps with rejuvenating the skin. It's my number one anti-aging to go procedure. It helps to illuminate your skin. It helps to rejuvenate your skin. It helps with acne scarring. It helps with fine lines and wrinkles. I'm sure you guys have seen the Kardashians, Kim Kardashian, you know, when she did it with her bloody face, this is what's going to happen. So you saw her face is a little bit oily, but it's not oily, it's actually a numbing cream. This procedure doesn't really hurt, but just to make the patient comfortable, we'll have to put a numbing on it for like maybe 20 minutes. So let's do this. Her blood is spinning down already. We're getting that ready, and once that is done, we're going to start the process. Any questions so far? Christina, do you have anything to add?
No, I mean, the numbing cream does numb the skin, so it makes this treatment very comfortable for the patient. They don't necessarily feel anything, but maybe a little bit of pressure.
Exactly. Okay. So, her skin type should be a skin type 5. Okay. So that means that everybody can get this from the fairest of the skin to the darkest of the skin. So if you want to improve your skin tone and texture, this is your to-go procedure. If you want to help with fine lines, some people don't like Botox, toxins. This is your go-to procedure. If you want to kind of help with your acne scarring, this is your go-to procedure. So are we ready for this? Okay. So Christina is going to help me. Can we have a pipette on it so that she can help me with this? All right. So we're going to start this procedure, and as we go along, and this is the pen. How does this feel? No,
I don't feel anything.
You're supposed to feel something.
A little bit of pressure, maybe?
Yeah, just a little bit of pressure. So we're doing the forehead, and this is her most area of concern, right?
Yes, ma'am.
Okay. And she has a dinner to go to tonight. She's gonna be a little red, but that's the most of it. By tomorrow she should be fine. And because we're using her own blood, the growth factor is telling her skin cells to heal because there's an injury already that I'm causing, a controlled injury. Okay, so let's go to the cheek area. And this is where she has her acne starting.
That area now.
Yes, it's numb.
Okay, I know people say beauty hurts, but we don't want anything to hurt. So this procedure actually also helps with the dark circles under the eyes. So unlike using some lasers that you cannot just go under the eyes or as close under the eyes, the orbits. This is a procedure that can really target those dark lines. Are you sleeping on me?
No.
Okay. So questions.
Very at this time.
Okay. So feel free to DM us with your questions. Even if it doesn't pertain to what we're doing right now, it's okay. We can always come back and talk about it. How do you feel?
Fine.
Okay.
My face is numb.
So I'm kind of doing these horizontal strokes, and I'll come back and do a vertical stroke, and then I'll just kind of. What I'm trying to do here is to work the PRP into the skin. Unlike other procedures that we do here with like the regular facial, um, this actually punctures the skin so that the PRP will penetrate and do its work. So what we're going to do afterwards is we're going to actually paint the PRP, kind of massage it into the skin. And what this does, it helps with the healing time. So like I said, platelet-rich factor is telling your skin to repair. There's an injury, so repair as fast as you can. And as you can see, she's red, but she's not all that. Okay? Does that tickle?
Mm-hmm.
You're allowed to sneeze if you want to. Okay. So the other thing, we're using blood for a lot of things right now. We're using blood also to help with hair restoration, and we're going to demonstrate that in a minute. The last episode that we had was the Keravive therapy. So we combined the Keravive therapy with the PRP. And like I said, it's telling the cells there, we need to repair, we need to rejuvenate. It's like putting a key in a lock to kind of tell the stem cells that we need to start working. So be it rejuvenation, be it healing, be it repair, be it glowing, the stem cells are going to work on that. Okay, so what are some of the contraindications? Can you just kind of paint it on?
Anybody that would have like open lesions on their skin, if they had like an active viral infection, a sunburn, very active acne.
Yeah, you don't want to do it. And then, of course, I think pregnancy is contraindicated as well. I just put that in there. Okay. So improve skin texture and tone, helps with plumping of the skin. She's gonna be a little bit red, and because she's putting that on top of it, it's actually gonna help with the healing very fast. Now, we recommend that you don't wear makeup for 48 hours.
Sunblock's a must if you go outdoors.
That's a must. That's a must.
Now, when I get home, what regimens do I need to do?
Gentle cleanser, moisturizer. I'd steer clear of any malic acid. Irritate the skin, so just keep it very basic.
Okay. And then, of course, I recommend sunscreen to everybody. So whether you're in the house, the last thing that you put on your skin should be a sunscreen, because the rays are actually what is causing the skin damage. So the frequently asked questions: does it hurt?
No.
It doesn't hurt. And is it safe? It's very safe because it's your own blood that we're using to actually rejuvenate your skin. What other questions do we have? What happens after a vampire facial? You don't have to do anything. Wash your face. Maybe if you have to wash your face, maybe tonight. Some people recommend don't do anything until 4 hours. I would say leave it on. I mean, just leave it on and then do your daily routine maybe at night and just use a gentle cleanser to wash your face. Can you wear makeup? Not today. 48 hours later, you can wear makeup. Um, you can wear makeup. Contraindications, she already told you that. Open wounds, we don't want to do that. Anybody with a blood disorder, we don't want to do that. Anybody that is on blood thinner, that really depends. It has to be with discretion. You know, your doctor should be able to say, okay, what kind of blood thinner are you on? If it's aspirin, that's okay. If it's Coumadin, then we're talking about a different kind of blood thinner. But that really depends because the PRP, like we painted it on top of her, that should help with the healing and with the bruising as well. So I think that's about it. What other questions do we?
I have a question. After the procedure is done, can she go about her daily activities?
Oh yeah, she works here, so she better be. She
What
better
about,
be doing her job.
what about exposure to sun?
Yeah, so just like as we said, we don't want her to go outside of, like kind of like bathe in the sun without the sunscreen. She has to wear sunscreen. That will be the last thing she does from now on. Okay. And we recommend a couple of sessions. It can't just be one fix it all. So if we're thinking about acne scarring, we need anywhere from 3 to 6 sessions to get this done. Price wise, this procedure can, depending on the area that you are, can go from
This procedure on its own can go upwards of maybe $700 to $1,500.
to $1,500. Yeah, the regular microneedling is anywhere from $250 to $300, depending on where you are and what they are using to do the microneedling. But with the vampire facial, is anywhere from $600 to $1,500. So that's about it. Now, what's that?
What's coming up next?
So the next, we're gonna still use this PRP to do PRP for hair restoration. And we have a model here, she already drew her blood, so we're gonna inject the PRP into her scalp. We already did the keratin like we did the last session, so now we're gonna inject the PRP into her scalp. Well, thank you very much, you really did well, so you can jump down.
We didn't put any numbing cream on it now.
Okay, so let's keep talking. How do you feel?
I feel
We don't
good.
need to get numbing cream.
My face is still numb.
Good.
Yes. Yeah.
I want to see a picture. I'm taking a before and after picture. I can see a difference either from the before than now because it's like the face is more cleaner and more fresher. Yeah, than it was before. Before I could see, some of the acne that was protruding out of your skin, and it's looked like now that they're beginning to diminish.
Yeah. So that looks good. So what's gonna happen is 4 weeks from now you're gonna do another treatment. And I think I'll recommend for you about 3 treatments. And then of course once in a while, maybe, until you get your desired result, and then you can just keep doing it. I mean, this is your own blood. You're using it to regenerate your skin. It doesn't matter. You can do it once a month if you want, as long as, you get the results that you need. Okay.
Is there an allergic reaction?
There's no allergic reaction. This is a very safe procedure. And because it's your own blood, so it's your own blood, you can't be allergic to your own blood. What we just did, we spinned it down, we activated your growth factors, and we're using it to rejuvenate you. So there's no there's no allergic reaction to this at all.
Will this dry out the skin?
Actually, it plumps the skin. It plumps the skin, like you can tell, even though she's a little bit swollen, but her skin is gonna be more glowy and
Vibrant.
luminescent and vibrant. So no.
Do I have to get a doctor's advice if I am a diabetic?
No, you don't have to. That's why you have to go to a licensed professional like me to do this procedure. You don't have to. It's not contraindicated. It's your own blood. As long as you have blood running through your veins, you have your platelets. You don't have a blood disorder. This procedure is safe for everybody across the board. I think there's another one.
It's
your
medical board certified doctor.
Yes.
How many times a year will I need to do this?
Okay, so like I said, we recommend anywhere from 3 to 6 treatments, okay, just to get, the result that is most visible. And then you can do this, like I said, once a month if you want, as long as you want. Once you attain the result, it's okay, you can keep maintaining it. I do this once every 3 months because my face has to be on point. And you have to go to a board certified doctor, okay, to get this done. I think there's another one.
My mother is 75 and she wants to do this. How do you advise?
She really can do it. Okay, so beauty doesn't look at age. Okay, she wants to look good at 75. That's great. She can do this. We, teenagers with acne scars to as old as 100 years old. It doesn't matter. So far, you want to look good and have a glowing skin. With good texture, good tone. You can really do this. Okay. Are we ready for the hair? And so this is a model, Keisha. We saw her last week, and we did the CeraVe hair treatment. So can you tell our audience how you felt and?
Oh, it was very relaxing, didn't hurt at all, and it was really interesting to see exactly what they got off my scalp because I wash my hair probably 3 to 4 times a week, but they were able to exfoliate my scalp, and so the stuff that they gave me to use when I went home felt good on my scalp and everything was okay, but it didn't hurt at all, and it was very relaxing.
Okay. Did you feel the hair was softer or? Okay, but that was just a week ago. Okay, so we'll have a second treatment later, and we'll let you guys see if they have. So we did take a before picture, so that's good. All right, so we're gonna inject her scalp with her own blood.
What are we doing here for those viewers who did not see the last week? What are we doing right now, and what are the expected outcomes?
Okay, so what we did the last time, we cleansed her scalp, we exfoliated it, we kind of opened up the follicles, and we added some peptides in it. So now we're going to inject her blood, PRP, into her scalp, and what this does is, like I said, the PRP, the platelet-rich plasma, is like a key. You put a key in a keyhole to activate the stem cells to tell the hair follicles, okay, start growing. Okay, start growing, start becoming thicker. That's what we're doing today. So we're actually injecting her blood into her scalp.
Okay, for hair growth, for
hair growth.
Okay.
So are we ready? We're already cleansed the scalp. I'm gonna clean more with alcohol just because we want to practice anesthetic procedure. Okay. All right. You ready? And then I guess at the middle of her scalp is where she has really, really lost a lot of hair. So we're gonna start there, okay? So let's relax for me. Do you mind just putting this down a little bit here? You ready? Just think a little bit. Oop. Okay, so she's supposed to have been numbed really good. So we're just gonna inject it into the into specific areas, especially where the most concern are. I think there's another question right
Yeah, let's see what this question is.
Can you help me with alopecia?
Mm-hmm.
there. Yes. So I don't know, you weren't here, maybe the last session you didn't get it, but she had, tell the audience
Sister
what you
locks.
had.
I used to have locks, and the weight of my locks actually made the top of my hair thin. And so when I took my locks out, it was really thin. So I went and got like this laser thing that was supposed to help with thickening of the hair and rejuvenating the follicles. It made all of my hair fall out.
Okay.
Wherever I put that light, the hair fell out. So I cut all my hair off, and I'm just starting over. But where I use the light the most, you can definitely tell that it's a lot more sparse than it is for the rest of my hair.
Okay, so what she has now is chemical alopecia. So yes, this procedure can help with alopecia. But I will also recommend that, you come in for a consultation, Ageless Aesthetics in Warner Robins. Come in for a consultation. We can start with the Keravive, just cleansing your scalp. Just like you cleanse your face, you have to cleanse your scalp. Open up the follicles, and then I will do this procedure on the areas that where the alopecia is. We also recommend you taking biotin. We have biotin, IV, iron that we use as well, just to help. It's a vitamin that you can use to just help. So that's one of the things you can do at home, but you can come into the office and get this procedure done. Okay.
Hi, I am interested in knowing about varicose veins. I can't hardly walk sometimes.
Ooh, you need to come see me like yesterday. Okay, so varicose veins, we treat them here. But also, I'm going to tell you that sometimes it's not just the veins that you see on the outside. The problem might be the bigger veins that are causing the varicose veins. So it's just like a tree has branches. So if you have problems with the valves in your big veins, they have problems, they're not closing very well, so they're causing all those varicosities. You need an ultrasound to make sure that you don't have problems with the big veins. And once that is treated, we can now treat the little veins. So call and schedule an appointment with us, 333-2595, or follow us on Facebook, Ageless Aesthetics, Warner Robins, Instagram at Ageless Aesthetics, Warner Robins. So how do you feel? I know this is a little bit, this is your first time getting shots in the head. So
She said when they hurt, she gets bad headaches.
when the what?
The varicose veins hurts that she gets bad headaches.
Yeah. So you need to get that treated. You need to get that treated. And with I've seen a lot of testimonials when you treat those veins. People that are some people that use cane actually start walking very well without the cane. So number one, you need an ultrasound. Make sure that you don't have venous insufficiency. Get that treated, and then we can now do the varicose veins. Because if you treat the varicose vein without treating the big veins, it's like putting a band-aid on a wound. Okay, Keisha.
Mhm.
How you doing?
Somebody said the doctor looks 30 years old. Oh my God.
Oh, that's so sweet of you. Thank you. Oh, but I'm 50. But I have a 21-year-old son.
Yeah. They said you look amazing.
Oh, thank you. Bless your heart. Yeah, so follow us on Facebook, Instagram. Call with any questions that you may have, 333-2595. And the broadcast is on at 10 o'clock every Thursday. I will answer any questions that you may have. Also, if you have questions, if you have a topic that you're interested in and you want us to talk about, feel free to DM us, and we'll have that topic for you. Okay. So, Cece, can you tell us about the Caribbean that you did? You don't say that.
Oh, Caravive last week, we did Caravive treatment. It was the hydrofacial for the scalp, exfoliates, cleanses, and nourishes the scalp with peptides and growth factors. So that's kind of like, I mean, like Dr. Anayo said, that would definitely be something that to get the best results from these types of treatments, it would be best to open up those follicles and try to get them a little more healthy before we start to do the PRP.
That's amazing. Okay, so with this PRP, she's gonna have a couple of sessions. For Keisha, I'm gonna do about 6 treatments on her, and then see where we are. We already took some before pictures, like I said. See where we are, and then can I go from there?
Someone said, I am viewing from Danville, Virginia. I am willing to travel to see you. Amazing.
Oh, we'll be privileged to have you to take care of you. And what would your concern be? Okay. So yeah, so this is our beauty channel. We do everything from hair to the legs. Like our viewer was talking about her veins, so we will take care of your vein.
She said she is the one with the veins.
Oh, okay. Okay, yeah, we'll take care of you. And our phone number is 478-333-2595, and you can follow us on Facebook, Ageless Aesthetics WR, Ageless Aesthetics Warner Robins. You can't miss us. Okay, how are we feeling? So we're gonna be numb. We're gonna be numb a little bit on the scalp after this, but it's gonna fill in like 30 minutes. So you have some bald patches, and that's where I'm focusing on. But this is where you really lost a lot of hair.
That's why I rolled that laser. So for probably 2 weeks, I would sit in my chair, and they said to do it every other day, and I would take this laser and I would roll it right there, right where you see the.
Is there any question? Okay. And that's what I tell people. You just don't buy things on Amazon and just you have to get a consultation with a licensed physician that actually know what they're doing. You have to look at reviews before you even go to the doctor. You just don't do these things on yourself, especially the face, the hair, your body in general, period.
So how long does it take before you see the results of the growth of the hair?
So that really depends on individual. It's individualized. As long as you do what we say, you're gonna see results. So I'm gonna say 6 weeks for the turnover.
Okay.
6 weeks. I mean, but she did the Caribbean. She already seen thickening of the hair itself. You can't just do one and leave the other. You have to do everything together.
Yeah,
like
so everything works together.
Yeah, everything works together. And I put her on biotin. She's gonna be taking the biotin.
Are not necessarily the views of the
She's gonna be taking the biotin. Yes. So thank you guys for watching. This is Ageless Beauty Broadcast, and we'll see you next week at 10 o'clock. Bye. Bye. Okay.
Umerah and Dr. Anayo Umerah, teaching you wholeness and keeping you healthy from the inside out.
For my guilt, you given me life within. You gave beauty for ashes.